This exercise program is designed for people who suffer from arthritis. Each movement helps increase strength and flexibility while also reducing joint pain and fighting off fatigue. First, we'll begin with walking. When walking, the hinge and ball and socket joints are used at the hips and knees, where extension and flexion occur. The gliding joint is used at our ankles, where there is plantar flexion and dorsiflexion. The bones used for this exercise are the hip bones, patella, tibia, fibula, tarsal, metatarsal, and phalanges. Next, we have the bird dog. The joints used are the ball and socket at the hip and shoulder, and hinge joint at the knee and elbow region. The arm is extended outward, while the opposite leg is extended backward. Here we have an upper body flexion with the arm, a lower body extension with the leg, and plantar flexion with the foot. Bones used are the humerus, radius, ulna, carpal, metacarpal, phalanges, hip bone, femur, tarsal, metatarsal, and phalanges. Now we have sideway arm raises. When the arms are lifted away from the midline, there is abduction. As we lower them back to the sides of our midline, there is adduction. The ball and socket joint is used at the pelvic girdle site, where the clavicle and scapula are located. For people whose hands are of particular discomfort, we have the hand squeeze exercise, which uses the carpal, metacarpals, and phalanges. Flexion and extension occurs as you extend and flex the fingers repeatedly into a grip position. For this exercise, the hinge and saddle joints are used. Rolling shoulders is an exercise that uses the ball and socket joint in the shoulder where the scapula and clavicle are. The dynamic movement is circumduction. This exercise helps relieve tension in the shoulders. Then we have the ragdoll, which is a flexion of the upper body towards the belly using the hinge and ball and socket joints in the vertebrae, arms, and shoulders while keeping the legs straight. Other bones involved are the humerus, radius, ulna, carpals, and phalanges.
Then we continue with the kneeling hip flexor, which is a flexion of the knee, extension of the back leg, plantar flexation, and dorsiflexion of the feet. Joints used are the hinge joint at the knees and ball and socket joint at the hip bone and the femur. Other bones involved are the patella, tarsals, metatarsals, and the phalanges. Next follows a seated hamstring stretch. As you bend your back using hitch joints at the vertebrae, a flexion towards the stomach as you lean forward. Both hands extend as they reach towards the toes. Other bones used are the humerus, radius, ulna, carpals, and phalanges. Now we have ankle circles, showcasing the dynamic movement of eversion and inversion, as the hitch joint is used when the ankle moves side to side. Bones involved in this exercise are tarsals, metatarsals, and phalanges. Knee raises will create a flexion at the same time that there is elevation. This exercise uses hinge joint at the knees and involves use of the femur, tibia, and fibula bones. Finally, we have neck circles, which uses the pivot joint at the neck region where the hyoid bone is located. The dynamic movements created by this exercise are circumduction, lateral flexion, as well as right and left rotation.